We're in the middle of a grave public health crisis. And if we're going to turn the corner, we need to focus our efforts on three things. 1, social distancing. 2, testing. And 3, contact tracing. All of these things have to happen together if we want to combat this virus and save lives. First, social distancing. Rigorous social distancing is key to containing the spread of the virus. The only way the virus can't find a new host is if there isn't a host anywhere close. The virus dies if it doesn't have new people close by to infect. Without new hosts, as people get better and develop immunity, the number of infections starts to drop. And that creates a virtuous cycle. If you can control the spread and limit the number of positive cases, then health officials can spring into action on cases that do pop up instead of being overwhelmed by thousands of new cases a day, as they are today. Second is testing. Right now, we aren't even close to being able to test the number of people we need to. We don't have enough swabs, we don't have enough reagent or machines that are used to perform the test. And our healthcare workforce is already stretched to its limits. In an ideal world, we would be testing everyone with symptoms and getting the results back instantaneously so that person can make quick decisions to protect their health and the health of others. Without testing, we're just guessing. And a lot of people who are infected but don't know it are spreading the virus. And the more testing you do, the more we know where hotspots are and how to best allocate our resources. Third is contact tracing. Now, this goes hand in hand with increased testing. In a true public health response, when you identify someone with the virus, you would then track down the people they've been physically in contact with so that those people can self-isolate. This is how China and South Korea turned the corner relatively quickly. And it's a big part of how we eradicated smallpox, Ebola, and SARS. These are our 3 priority tasks. But let's be honest. Right now, the Trump administration isn't getting any of them right. Some states have implemented social distancing measures, but others haven't. We're an interconnected nation, only as strong as our weakest link, and the lack of tougher national policies leaves us all vulnerable. Testing has been a nightmare from the beginning, and the president still refuses to step in and start requiring manufacturers to make the scarce supplies, like the simple swabs, that we need to do more tests. And without tests, we can't do effective tracing. And the Trump administration has no plan to create a public health infrastructure necessary to trace back millions of cases. We need a coordinated national public health response that focuses on social distancing, testing, and contact tracing to help contain the spread and defeat the virus. And we need it now.